3, 4, 5. Check, check, check. All right. Check, check, check. 3, 2, 1. Public health and race, an anthropological perspective. Here's an outline of our lesson. Today we're going to cover the definition of race, culturally speaking, actual genetic variation in populations, the definition of public health, the impact of race on public health, how COVID-19 fits into all of this, and what we can do going forward. This is a quote from Swiss explorer, psychiatrist, and environmentalist Bertrand Piccard. As a real explorer, he says, pioneering spirit should continue, not to conquer the planet or space, but rather to improve the quality of life. Before we get started, we just wanted to take a brief moment to describe anthropology. Anthropology is the science of human societies and their evolution over time. It is a large umbrella term, literally pictured here as an umbrella, that includes fields like linguistics, archaeology, biology, and the study of cultures. Today, we will use anthropology as the lens that we examine race and public health with. It's helpful to know that anthropology is not purely a biological or cultural study, because the issues we discuss won't be purely biological or cultural either. Defining race is really important because it is a term that is often misused. There are a lot of things attributed to race casually that really shouldn't be. Here's a quote that illustrates this from Toni Morrison, a well-known African-American novelist. She said, "There is no such thing as race. None. There is just a human race, scientifically, anthropologically." Race is a term used to group humans based on shared physical or social traits into categories that are generally seen as distinct. Originally, race was used to group people by the language they spoke and then later by their nationalities. But since the 17th century, race has been used to refer to physical traits like skin color. A lot of people think that if race doesn't cover the things they thought it did, then maybe ethnicity does. But in reality, even ethnicity has a relatively limited definition. Ethnicity groups people not just by the color of their skin, but by their nationalities, tribes, religions, spoken languages, or cultural origin. Many Americans, including doctors and healthcare professionals, believe that race is more than just the color of your skin. In fact, a 2018 poll from Northwestern University and 23andMe, more than half of Americans believe that their racial identity is determined by their DNA. In reality, genetic variation seems to have little to do with the divisions of race. Genetic variation can be greater within what society deems as one race than between races. This image shows the 5 races as different colored figures. The lower part of the image shows how genetic variation is actually divided up within those figures. You can see that some groups have more variation between themselves than with other groups. Defining public health. Public health is the science and art of preventing disease, prolonging life, and improving quality of life. It is the organized efforts and choices of society, private and public entities, communities, and individuals. Think of public health as the healthcare professionals, hospitals, clinics, government agencies. It is all of the people and places that work towards improving the welfare of a population. Impact of public health on race. Here's a quote from Dr. Camara Jones, an American physician, epidemiologist, and anti-racism activist who specializes in the effects of racism and social inequalities on health. Below are some impacts of race on public health, which are stereotypes of addiction risks in people of color that lead to pain mismanagement. Conflation of race with genetics leads doctors to underdiagnosing osteoporosis in black patients. After a history of medical abuse, black patients are less likely to trust/visit healthcare professionals, and black mothers are more likely to die giving birth due to a lack of sympathy and respect by doctors. In a survey of white medical students and residents, half of them endorsed at least one myth about physiological differences between black and white people. Many believe that black people's nerve endings are less sensitive than white people's. When assessing pain in hypothetical situations, the medical workers studied insisted that black people felt less pain and recommended less treatment. Here's a short video on health equity.
grandmother tells a story of hospitals in her day. One of barriers, one of trauma, one of fear. When we are sick, she pulls remedies from a tattered notebook, recipes passed through generations of those misunderstood by the world around them. She ensures this cold, this ache, this fever will break by morning. All we need is this prayer, this herb, this belief that better days are coming. She doesn't speak of bad health. She says with stern eyes, only speak life. A lesson, a warning, and a hope in one. Packaged words birthed from a time when healthcare didn't look like help for us. I feel this chill down my spine when I am ill. When my only option left is a doctor's office or the never-ending maze of a hospital. The fear that there will be assumptions about who I am, that things will be ignored like culture and beliefs, that I won't be heard, that history repeats itself. Fear that these hallways will be the same broken roads instead of bridges to new understanding. I envy those who don't have to sit with crossed fingers hoping. Envy their peace of mind and comfort. All anyone wants is to be understood, to be heard, to be told that help is actually on the way.
COVID-19 and race. COVID-19 has put many issues in the medical field under the microscope, and they are more present now than ever. Black people made up 30% of COVID-19 hospitalizations in South Carolina, while they only make up 20% of South Carolina's actual population. Discrimination still exists in many systems meant to protect well-being, and its existence limits the quality of care certain groups may receive. COVID-19 and race, possible causes of inequity. Discrimination, lack of sympathy for people of color in pain, strong correlations between poverty and people of color, and weathering. Some ways we can fix this include educating professionals, employing diversely, and educating ourselves. Be informed and inform others. Help others understand that skin color does not reflect health needs or risks. Thank you guys for tuning into this lesson on public health and race. Here are our sources that we use to complete this lesson.